Today, we're diving into a topic that might not get as much attention as it deserves: how medications can mess with your mouth. Yep, you read that right. Those little pills you pop for various ailments might be causing some unexpected changes in your oral health. But fear not, we're here to break it down for you and give you some tips on what you can do about it. Number 1. Dry mouth. Ever felt like your mouth is drier than the Sahara Desert after starting a new medication? You're not alone. Dry mouth is a common side effect of many drugs, from antidepressants to opioids. The lack of saliva can lead to discomfort and even dental issues. The good news? There are ways to combat it, like staying hydrated or using saliva substitutes. Also, try to avoid dry, salty, or acidic foods and opt for sugar-free gum or candies to stimulate saliva production. Number 2. Gum overgrowth. If you've noticed your gums growing faster than Jack's beanstalk, it might be due to certain medications like anti-seizure drugs or blood pressure meds. Good oral hygiene is key here, along with regular dental checkups to maintain those gums in check. Make sure to brush and floss regularly and consider using an antiseptic mouthwash to help prevent gum disease. Number 3. Oral ulcers. Those pesky sores can pop up unexpectedly. And while medications like NSAIDs or antibiotics are rarely to blame, it's worth keeping an eye on. If you're battling oral ulcers, talk to your healthcare provider to find the best course of action. They may recommend topical treatments or adjustments to your medication regimen. Number 4. Oral thrush. No, it's not just something babies get. Oral thrush or yeast infections in the mouth can be caused by inhaled steroid medications. Rinsing your mouth after using these inhalers can help prevent this uncomfortable condition. If you do develop thrush, your healthcare provider may prescribe antifungal medication to clear it up. Number 5. Black hairy tongue. Yes, it sounds gross, but it's not as scary as it sounds. Certain antibiotics can mess with the bacteria in your mouth, leading to this temporary and harmless condition. Brushing your tongue can help, and the good news is it usually clears up on its own. However, if you're concerned or if it persists, don't hesitate to consult your dentist or healthcare provider. We made a book, 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 6. Weird taste. Ever bitten into an apple and tasted fish? Yep, medications can do that too. Changes in taste are not uncommon, but they can be bothersome. Sometimes it's just a matter of finding a workaround, like masking the taste with something else. If the taste changes persist or interfere with your ability to eat, speak with your healthcare provider. They may be able to adjust your medication or recommend strategies to help alleviate the issue. Number 7. Osteonecrosis of the jaw. Okay, this one's a little scary. Certain medications for osteoporosis and cancer can cause parts of your jawbone to break down. Regular dental visits and good oral hygiene are crucial if you're on these meds. Make sure to inform your dentist if you're taking medications that may increase your risk of osteonecrosis of the jaw, and be vigilant for any signs or symptoms such as jaw pain or swelling. Number 8. Burning mouth syndrome. If your mouth feels like it's on fire but there's no obvious cause, you might be experiencing burning mouth syndrome. Some medications have been linked to this uncomfortable condition, so it's worth discussing with your healthcare provider. They can help determine the underlying cause and recommend appropriate treatments, which may include medications or behavioral therapy. Number 9. Tooth decay. Dry mouth strikes again. When your saliva production takes a nosedive, your teeth are left vulnerable to decay. Certain medications, including opioids and antacids, can up your risk of tooth decay. So it's important to take care of your pearly whites. Make sure to brush and floss regularly, limit sugary foods and drinks, and consider using fluoride treatments or saliva substitute to help protect your teeth. Number 10. Tooth discoloration. Nobody likes yellow teeth, but certain medications can cause just that. From antibiotics to cholesterol meds, some drugs can leave your teeth looking less than sparkling. Thankfully, your dentist has a few tricks up their sleeve to help you reclaim your bright smile. Depending on the severity of the discoloration, treatments may include professional teeth whitening, dental bonding, or the placement of veneers or crowns. So, how can I avoid all these mouth complications? Avoiding medication-related mouth problems is all about taking care of your oral health in a way that feels natural and easy. So let's break it down. First up, staying hydrated is key. Keep a water bottle handy and sip throughout the day to keep your saliva flowing and prevent dry mouth. It's like giving your mouth its own little oasis. Next, let's talk about brushing and flossing. Yep, the classics. Brush your teeth twice a day and don't forget to floss daily. It's like giving your teeth a little spa treatment, keeping them clean and happy. Oh, and don't skip those regular dental checkups. Think of it as catching up with your dentist pal who's always got your back. When you're starting a new medication, give your healthcare provider the lowdown or any oral health issues you've got going on. They'll appreciate the heads up and can give you personalized advice to keep your mouth in tip-top shape. And speaking of medication, follow those instructions to a T. It's like following a recipe, stick up the measurements, and you'll whip up something great. Now let's talk lifestyle. Avoiding tobacco, cutting back on the booze, and watching your sugar intake are all good moves for your mouth. And if dry mouth is cramping your style, reach for some saliva substitute or sugar-free gum to keep things feeling fresh. Last but not least, keep an eye on your mouth. If anything seems off, don't hesitate to chat with your healthcare provider or dentist. They're like your oral healthcare detectives, ready to swoop in and save the day. So there you have it. Taking care of your oral health is a conversational nutshell. With a few simple steps and a little TLC, you can keep those medication-related mouth problems at bay and rock a healthy smile. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.